Well, we talk about it every year at this time, and every year people get sick from food poisoning and get burned from fireworks over the 4th of July weekend. So joining us to remind us to use our noggin this weekend is Dr. Richard Chaffoo. All right, Dr. Chaffoo, thanks for being here.
Good to be here, Jen.
All right, first let's talk about fireworks, even sparklers. What should we know if we want to use those? I'm pretty sure fireworks are illegal here in California, but I do see people use the little ones.
Yeah, exactly. And the problem is with those, Jen, is there are significant injuries that people can get from these fireworks. You can kind of consider them mobile explosives. Obviously, they're not very well controlled, they're not very well regulated, and you can get serious eye injuries, burns, inhalational injuries from the smoke. You know, your house can catch on fire, clothing, etc. So they really should only be operated by skilled professionals that do this. And you want to be a safe distance away with your children, somewhere, you know, preferably upwind versus downwind and far enough away from any particles. But certainly trying to do this in a home environment situation is potentially very dangerous.
Yeah, I'd say just stay at home and watch our coverage with the Big Bay Boom that we air the fireworks live. It's a pretty awesome option. All right, Dr. Chaffoo, let me talk to you about drinking. 4th of July, obviously a big drinking holiday.
Of course.
We always kind of warn people, drink water, make sure you have a lot of food, but this weekend is supposed to be hot. So talk to me about how heat can affect how alcohol affects your system.
Well, great point, Jen. In fact, we do know that, you know, if it's a hotter environment, we're going to tend to get more dehydrated more quickly. And, you know, sometimes people unfortunately turn to alcoholic beverages, beer, wine, etc., thinking, oh, well, that'll quench my thirst. But the problem is, as we all know, is it's a diuretic. So instead of actually quenching our thirst, it may in the short term, in the long term, we become more concentrated, actually more dehydrated, then we want to drink more, and it's a vicious cycle. So and of course, in that situation, if you have an empty stomach, you're relatively dehydrated, the negative effects of alcohol on one's judgment, ability to operate a car or a boat are significantly impaired. And so in that situation, the best advice that, you know, that lawmakers, that the highway patrol, that physicians give patients is, you know, if you're going to be operating any dangerous equipment, no alcohol, or certainly make sure that you're with someone that's a designated driver. You know, about 17 to 18% of fatalities from boating injuries are alcohol related. And we certainly know the number is much higher when it comes to automobiles.
Yeah, and of course we've got the water right here in San Diego. Before I let you go, let me talk about foodborne illness. You got to put away that potato salad that's still sitting out in the Fox5 kitchen, who's ever listening.
You do. So there are two numbers for the audience to remember, 140 and 40. And 140 being if you're going to heat food and cook food, you want to have a thermometer to get that up to at least 160 degrees. We know that 1 out of 4 burgers actually takes till it gets brown to reach that critical temperature. And once you've heated food up or you've cooked it, Jen, you want to keep it at least 140 degrees or higher. The opposite goes for cold food. As you said, you know, salads and other such things, potato salad, where they have egg, they're a great medium for bacteria. You want to keep the temperature below 40 degrees, so above 140 for hot or heated foods and below 40 for cold. And that's going to reduce the chance for you to get, you know, serious illnesses. 3,000 people a year die from food poisoning, and at least 150,000 a year are hospitalized. And of course, many more than that get mild symptoms and don't get treatment. So it's potentially a very serious problem.
Let me tell you, food poisoning, no bueno on that one. Dr. Chaffoo, thanks for being here. Appreciate the insight.